Hi, Dr. Aldin, CEO and founder of Pronto Cure. I'm the heart doctor. We're trying to get for you folks, those who need to be educated about various conditions that will lead to heart disease and how we can identify, fix it, and to prevent really devastating events when it comes to heart disease. Talking today about risk factors called hypertension or high blood pressure. What does that mean, doc? And how prevalent it is? Well, in only half of the U.S. population named to have high blood pressure. And what is that qualifies it? A blood pressure more than 130. The upper number is called systolic, over 80, which is the lower number 80. Diastolic is basically hypertension. Why such a big deal? We make it out of high blood pressure. If we can, we just leave it. Yeah, it's called a silent killer because it can lead to devastating events like stroke or heart disease, heart attack, or kidney failure. And a lot of people go into kidney failure and dialysis knowing that they had high blood pressure for a long time that was not addressed by risk factors and modification with medication and get it under control. So TOD or target organ damage is preventable for most of the cases. Most of the hypertension, 95% is called idiopathic or unknown reasons for it, but we just have it. There are other known reasons that we know about that high salt intake, especially in the African American population, which are salt sensitive. We know that excessive intake of alcohol, smoking, again, obesity, and of course, stress in life in general will lead to that. There are some other rare causes like coarctation of the aorta and renal artery stenosis and other things that are rare in the order of commonality. But we're talking about the most important common one is the idiopathic or unknown or essential or primary hypertension or high blood pressure. So now that we took three blood pressure in a resting situation in three different times, and it's persistently higher than 130 over 80. Well, what are we going to do about it? First, identify the called risk factor modification. We limit the salt. We do stop smoking and avoid alcohol excessive intake, and then we increased physical activity, and then we do measurements in the first couple of months or so to see if that goes away, goes down. If it doesn't go down where it's safe, then we can add medications, and there's a whole bunch of medications and choice of medications based on the patient concomitant disease and also other factors as well that the patient may need to be considered in basically tailoring the proper blood pressure medication regimen. And then we have to do a couple of tests to look for target organ damage, like we discussed, an echocardiogram, a sonogram of the heart to see if the heart is thickened, see if the chamber is large, to see if there's any valve issues that comes along with when the heart thickens and or the heart is weakened. Because the blood pressure after a while it just burns out the ventricle and it leads to weakening of the heart and it leads to heart failure. And that's a big separate topic we'll talk about. But hypertension is a big player and a common cause in all the most of the heart disease. And I guess all over the world it's the most common disease as well. Just like we have almost half of the population in the United States with high blood pressure. So after we do risk factor modification with the echocardiogram as a kind of take a look and see how the heart is performing, we design the medications and the lifestyle modification to really bring it out. And then a lot of trials have been really shown an absolute benefit of the blood pressure control. It's called SPRINT trial, specifically to prevent strokes, heart disease, kidney failure, and dementia, even in population, because when the blood pressure is good uncontrolled, it can lead to strokes, and that can lead to dementia. So there's a lot of benefits in early intervention to find out about heart disease, to diagnose this, and to control it. And I hope that you can continue to learn and tell your friends about Pronto Care educational channel here that will hopefully transform your life into a healthier life and to prevent any health condition that could be avoidable and it could be very devastating. Thank you.